Hi all of you, welcome back. Now in this short video, I'm going to discuss one of the very important areas in orthodontics, which is related to smile design. Okay, we'll have some short videos. So now coming to this question, what is the purpose of assessing buccal corridors in smile analysis? It's a very important area, the buccal corridors. Now before going on to this question, I'll be making you understand what basically buccal corridor is all about. Okay, so you can see this image. Okay, now basically it's a distance between lateral junction of upper lip. So this is the lateral, upper and lower lip in fact. So this is the lateral junctions. You can see the red markings there. The distance between the lateral junctions of the upper and lower lips and the distal points of the canine. Okay, the distal points of the canine. Now here, I would say this slightly varying distance is shown here anyway. So distal points on the canine. Now basically this distance, okay, this distance, or now as per the marked in this particular image, this distance, okay, slight variations will be there, isn't it? While smiling, that's important. So this distance, the distance between the corners of the mouth and the distal part of the canine is called the buccal corridor. Okay, now your books further goes and says, your standard textbooks like Profit further says it, or I would say further complicates it, saying that it's represented by the ratio of intercommissural width. I'll first write it, intercommissural width. Okay, intercommissural width, the ratio of intercommissural width divided by the width between the first premolars. Okay, first premolar to first premolar. So width between the first premolar to premolar. Okay, so if I go here, I will explain this here. Basically what it says is the intercommissural width. So the ratio between the two commissures. Okay, this divided by, yeah, this. Okay, first premolar to first premolar. This ratio is what you get the value. If you want to get the value, this is what the buccal corridor is. Okay, now it's good to know it. Now basically, what is the importance of buccal corridor? You can see this image. Okay, these two areas. See this area, which seems to be like slightly, increased buccal corridor, isn't it? This particular area is called the buccal corridor when the patient smiles, and it seems to be darker. Okay, now if it is too much, the smile will not look very pleasing. Okay, like in this case, and especially this happens when there is the arch form is narrow, as in this case of this child here, the arch form is narrow, and as a result there is a larger buccal corridor. Now here in this second image, you can see that the arch form is normal, and thus the buccal corridor is actually very minimal, or I would say adequate or ideal. Okay, now what happens if the arch form is very broad? Okay, what happens if this excessive width of the arch? It will be a denture, like there is no buccal corridor, and the smile looks like a patient has put the denture in the mouth. Now this is very important when you do orthodontic treatment. Okay, you can't go narrow, you can't go wide. Now basically coming back to our question here. Okay, what is the purpose of assessing buccal corridor? Now the answer for this is D. Okay, to understand the space between lateral junctions of the lip and canine. Okay, so if you understand that space between this area, okay, and analyze it, if it is too much, excessive, then it is larger buccal corridor. Okay, now there is a small, people might understand the space between medial junction. No, there is nothing like a medial junction of your lips. So answer, that was just to confuse you, lateral junction. Okay, not lip curvature or incisor. So basically it is the dark space, okay, in the arch, to identify the dark space in the arch. Okay.